Good morning. My name is Kim Thorne. I'm going to be your nurse today. How are you?
Good, well,
Good. Could you tell me your name and date of birth?
Vanessa Solcona,
Okay, Miss Vanessa. And can you tell me if you are allergic to anything? No allergies, not even latex or balloons, anything like that? Okay. So we're going to be doing a set of vital signs today, okay? You having any pain on a scale of 0 to 10, with 10 being the very worst? Any pain? Good, perfect patient. 0 pain, no allergies, right? Okay, so we're first going to start off taking your temp. And even though you're not going to see this at the hospital cleaning the probes, you clean the probes before and after, okay? So just want to pull your little let's find some sleeves that actually work. It works better because they're stuffed in back here. And all of you all have had a chance to get your hands on these because these are the ones you're kind of going to use the most at the hospitals, right? How about the nursing home, Christina? Do they use these at the nursing home too?
They're no, they're different at the nursing home. They use either the little scanners, the little temporal scanners,
Okay.
or just like the ones that you would get at Walgreens or something like that. Just the other oral little digital ones.
Okay, and her temp was 982. And sometimes it's good too to ask them if they've had coffee or something to drink if the temp's not a good temperature. But you're going to show it to the instructor. And one thing I don't have at the bedside right now, but we will have is scraps of paper. So you're welcome to document those so that you and your instructor can line them up when you get done. Okay, it's totally up to you which one you want to do next. You can do the blood pressure, you can do the radial, but let's let you be the nurse instructor, okay? Or, yeah, you come over and be the instructor, and especially since you have your minute time or your second-hand watch. So we're gonna come over here, and I'm gonna feel for her radial. Radials are best felt right below that purple right here, right in that groove, okay? And of course, it's on the thumb side, that's why it's called the radial. Okay, and then I have it really well. Do you have it? Okay, and so we're going to say, all right, when the second hand gets on the 12, we'll begin counting for a minute. And then we're both going to sit here and count for the full minute. And at the end of the minute, the student's going to express what they got. And if it's within 2 of what I get, then you've passed that part. Okay? Then we'll say, okay, now we're going to do respirations. Now with a real patient, you're not going to say you're going to do respirations. You're just going to pretend like you're still counting the radials. Come here, instructor, how you doing? So then she's going to say, okay, we'll start on the 6 or whatever. And so she and I'll sit and watch the chest rise and fall. Some people aren't chest breathers. You might want to watch the abdomen, the t-shirt. Sometimes you can see it. Rise. Are you a belly breather? Okay. Okay, and then at the end of the minute, again, you're going to call out what you got. Then we're going to take the apical, and I'm not going to do this on video to expose you, but I've taught you all how to go up under the shirt without having to pull the whole shirt off. The girls will lift their bra so that we're going right up under there. Where are we finding the apical? Mid-clavicular, fifth intercostal, okay. And then both the instructor and myself are going to listen at the same time. We're just pretending. And then she's going to say on the count of 2, and then we're going to listen for the full minute and give what you got. Okay? And then last, like I said, I would encourage y'all to do the blood pressure last. You can honestly do it however you want. It's just that your nerves are a little bit calmer once you've gotten the first 2 or 3 things correct. And then we'll do blood pressure. Is there ever a time you would not do a blood pressure on a particular arm?
a stent or an IV or something in it.
Okay. Or if someone's had a fistula or a mastectomy, you wouldn't want to do it on that side, okay? You can go ahead and try to feel the arteries to see if you can palpate them. Sometimes you can, sometimes you can't. She actually has pretty strong ones. So you'll want to place that arrow right over where you feel the strongest, about 2/3 of the arm, right? And we say just kind of loop these up under so that you and the instructor have a good visualization. And then I do this so they can rest their arm. Their pressure's gonna be up if they're sitting there having to hold that arm steady, right? Make sure the legs aren't crossed. And then you and the instructor's pretty shy over here. Come here, girl. You and the instructor are going to listen together. Now, when we're saying try to cut back on distractions, as much as you can keep this tube away from this one and not rubbing against each other the whole time, the better. It's also important, even though I learned to put my finger over the diaphragm or the bell of this stethoscope, it's better to put it flat and hold it down firm. Don't be afraid to push in firm. Don't just lightly place it there, okay? And then you're gonna keep this away from your other fingers and you're gonna stay as steady as you can. Pumping that up. How far up do we want to go? What'd y'all say?
200.
Is that what their book says? Okay, you're gonna go 200 and then you're just gonna slowly release it. I encourage you, don't go real fast because you're gonna pass it way too quickly. So slowly release it until you hear that systolic. Keep letting it go down till you hear the diastolic. And even after you're confident you have the diastolic, wait just a little bit longer. Most cardiologists will tell you to go down another 10 because sometimes the diastolic will wean out and then all of a sudden you'll hear it again. Okay, so as soon as you hear that diastolic, don't release pressure. Let it go down another 10. Any questions? And then of course she's going to call out what she got and hope it's within 2 of what the instructor has, right? Okay. Any questions? We all good? All right, let's break up.